knee replacement surgery for the worn-out knee has advanced tremendously globally over the last 50 years. Implant designs have changed, and they have really become less invasive. The term knee replacement is a historic term, whereas the modern knee replacement here on this model shows that it is really like a resurfacing, where the end of the worn femur is covered with a very thin and knee-shaped surface, and similarly on the tibia and the back of the kneecap can be covered. So although these are called total knee replacements, fundamentally they can also be described as total resurfacings of the surface of the knee. As an alternative, if only one of the three compartments of the knee is affected, then one can get away with a partial knee replacement. And this is a model of a partial medial inner unicompartmental replacement. So these are the kind of implants that people will need if they've worn out their knee. There have been tremendous advances in knee surgery. The implant manufacturing has got better, and implants now are pretty hard bearing, and they should last the best part of 3 decades or more. The designs of the implants now mimic the natural kinematics of the knee. So patients can get back to very energetic activity, swimming, cycling, skiing, playing tennis, playing golf, etc., and return to an active lifestyle. The advent of robotics has allowed, in certain circumstances, precision to improve. And that means that the outcomes will continue to improve in time. And the advent of data collection and artificial intelligence means that we can then study trends of any surgical changes we make, and then continue to refine the process. So it's a tremendously exciting speciality where patients with knee deformity, pain, loss of function, and people who begin to lose quality in their life can now be restored exceedingly well back to superb function. And my life's work has been to do lots of improvements in this space. I perform about 600 knee replacements every year, and in 2026 now have done close to 9,000 partial, totals and revision knee implants over my career. The other thing that I'm passionate about is trying to make this process less painful, and to promote what is called the less painful knee pathway.